COVID-19 has taken its toll on all age groups. However, obesity was pinpointed as a risk factor for severe COVID-19 early in the pandemic, reflected in the UK vaccine rollout in 2021, which prioritized people with a high BMI over 40 as a high-risk group. However, little was known until now about the effectiveness of the COVID-19 vaccines for people with obesity. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to discuss about how people with obesity are less likely to take flu vaccines and have reduced benefits, although the reasons for this are not well understood. COVID-19 vaccines greatly reduce the number of cases of severe COVID-19 disease for everyone regardless of their body size, according to the new study published in the Lancet Diabetes Endocrinology. Vaccine's effectiveness was similar for those with a higher BMI and of a healthy weight, but slightly lower in the underweight group, who were also the least likely to have been vaccinated. In a further analysis of vaccinated people only, among the fewer COVID-19 cases recorded, people of very low and very high BMI were more likely to experience severe disease than vaccinated healthy weight people. This replicates the findings seen in previous analysis before the vaccination program commenced. Researchers searched anonymized health records for more than 12 million patients across 1738 GP practices in England taking part in Q Research, a secure database of healthcare information available to verified researchers. Of these, 91,71,524 patients who were over 18 years old had BMI data had not previously been infected with SARS-CoV-2 were included in the study. People were grouped based on their BMI according to 4 World Health Organization definitions of 18.5 to 24.9 kg per square meter for healthy weight, below 18.5 for underweight, 25 to 29.9 for overweight, and 30 and over as obesity, with levels adjusted for Asian people to reflect the higher health risks at lower BMI levels in this group. Characteristics such as age, sex, smoking status, and social deprivation were also accounted for in the analysis. Out of the 9 million people at the end of the study period, 23.3% of the healthy weight group, 32.6% of the underweight group, 16.8% of the overweight group, and 14.2% of the group with obesity had no doses of any COVID-19 vaccine. In comparison, people in the healthy and high BMI groups who were vaccinated were around 70% less likely to be hospitalized than the unvaccinated people. People with a healthy or a higher BMI were also around 2/3 less likely to die than their unvaccinated counterparts 2 weeks after a second dose. The authors ended that the cause of the increased risk among people with obesity is unknown. It is consistent with the higher rate of seasonal flu infections in people with a higher BMI. They speculate that their findings may be explained in part by an alternate immune response in heavier weight individuals. The reduced effectiveness of COVID-19 vaccines among people with a low BMI may also reflect a reduced immune response as a consequence of frailty or other conditions associated with low body weight. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.